What if understanding a child's behavior could change the entire course of their life? From emotional meltdowns to silent anxiety, from learning struggles to identity formation, child and adolescent psychology interns work at the front line of human development. In today's video, we're breaking down child and adolescent psychology internships, the structure, the science, the career power, and the unique realities that most people never talk about. This is not just an internship. It's a window into how the human mind is built. Child and adolescent psychology focuses on mental, emotional, cognitive, and social development from infancy through late adolescence. Unlike adult psychology, this field recognizes one key truth. Backhand index pointing right: children don't think like adults, and teenagers don't feel like children. Interns study how brain development affects behavior. Family systems shape emotional health. Trauma alters developmental pathways. Early intervention changes long-term outcomes. Let's break down the core specifications of a child and adolescent psychology internship. Duration: 6 months to 1 year. Hours: 800 to 2,000 supervised hours. Supervision: licensed clinical or child psychologists. Training style: observation, assisted practice, independent case involvement. Common settings include child mental health clinics, schools and special education centers, hospitals and pediatric units, NGOs working with at-risk youth, private therapy practices. Interns don't just observe, they learn to interpret behavior through a developmental lens. Here's where theory meets reality. Interns may conduct behavioral observations, assist in psychological assessments, support therapy sessions, play therapy, CBT, family therapy, document developmental milestones, help design intervention plans, work with parents, teachers, and caregivers. One key insight interns learn early: pushpin a child's behavior is communication, not defiance. What makes this internship uniquely powerful? Small Blue Diamond: you witness personality formation in real time. Small Blue Diamond: you see how early trauma impacts adult mental health. Small Blue Diamond: you learn nonverbal assessment skills. Small Blue Diamond: you develop extreme emotional intelligence. Small Blue Diamond: you train in ethical decision-making involving minors. This internship doesn't just teach psychology. It rewires how you understand human behavior. Interns work with some of the most influential psychological frameworks, including Piaget's cognitive development theory, Erikson's psychosocial stages, attachment theory, Bowlby and Ainsworth, behavioral and cognitive behavioral models, neurodevelopmental research. You begin to see patterns most people miss, like how school refusal can signal anxiety, not laziness. This internship unlocks multiple career paths: clinical child psychologist, school psychologist, developmental therapist, child protection and NGO roles, research and academia, counseling and family therapy. It's also a mandatory stepping stone for master's or PhD programs, clinical licensure, international psychology certifications. This field is deeply rewarding, but not easy. Challenges include emotional burnout, exposure to trauma cases, ethical complexity, slow progress with some clients. But here's the truth. Lightbulb: helping a child early can prevent decades of suffering later. That impact is priceless. A child and adolescent psychology internship isn't just a resume line. It's an initiation into understanding how humans become who they are. If you're intellectually curious, emotionally resilient, and driven to create real impact, this path might be calling you. If this video helped you see psychology differently, hit like, subscribe, and share it with someone who's passionate about the human mind. Because understanding children is understanding the future.